Social skill programs are offered to children with a variety of needs. They're a really common treatment approach used specifically for kids with autism spectrum disorders because social skills are such a core part of the deficits of those disorders. Social skill groups are often used for kids with autism spectrum disorders, and they're offered to kids with a wide range of abilities and also a wide range of ages. Groups can be run in a couple of different ways. Sometimes they are more overarching, but traditionally what seems to be the most successful is when groups are really focused on some very specific social skills. And the way those are usually selected are based on the needs of the individual group members. So often what will happen is there's an assessment in which children are interviewed, parents are interviewed, and then some very specific social skills are targeted as part of the intervention. So a really good social skills group should include some specific strategies aimed at generalizing the skills that are taught. So one of the things they would want to look for is that they are also receiving instruction as part of the group. So that might include exercises that they might complete with the child outside of the group, ways that they could reinforce the activities that are featured in the group in the community. So there should be a really nice connection between what's done in the group and what's done in the home and community setting. So the way we typically structure groups here at our center is that there's usually two main parts to a group. There's sort of the didactic structured piece, and then there's a more interactive, engaged part to the group. So the didactic structured piece is really where we, again, try to take these abstract skills and make them really concrete by giving kids some very specific guidelines. For example, we teach them how to come up with a conversation starter, and we'll give them a couple cues or ideas of how to do that. But then we try to put them into sort of very typical real-life situations, interacting with their fellow group members, where they're then asked to apply those skills. And we feel like both pieces are really needed in order for the skill to be learned and also for the skill to really be genuine. I think in the past sometimes we taught these sort of rote skills and kids would sort of memorize what to do and then try to apply them, and it would come off seeming sort of rehearsed or scripted. But when we have this more engaged piece that's more naturalistic, it seems to really improve the generalizability of the skill that we taught. So one of the key things is really making sure that the group is going to be able to target their child's individual needs. What they would want to shy away from would be a group that has sort of a rote curriculum where they're just working on the same skills with every group member, and it isn't really targeting their child's individual needs. It's also important that the group consist of other group members of similar abilities. You would want the group to consist of members that have similar language abilities, similar levels of understanding, and also similar social skills and social needs. Ask them about the types of ways they go about screening the children who are part of the group, how they go about selecting their specific social skills targets, the ways they go about then actually providing instruction to the social skills, about the social skills. So specifically, is there didactic instruction, ways that they really make these abstract skills very concrete, but then also how do they go about making the group engaging? You certainly don't want the kids sitting there bored and not really participating and getting the most they can out of the group.